We are live. Welcome, everyone. It's Friday, May 8th. Thank you for joining us for another media briefing. Today, we will hear from Acting Medical Officer of Health, Dr. Hsiu-Li Wang, as well as have an update from Regional Chair Karen Redman. So we'll start with Dr. Hsiu-Li Wang. Go ahead, Hsiu-Li.
Thank you. First, sadly, we continue to see COVID-19 deaths in our community. To date, 101 people have died. This is what we sadly can continue to see after infections have occurred. And what we are seeing here is what we are seeing across the province. I wish to express my deepest condolences to all the families, friends, and caregivers who have lost loved ones to COVID-19. There are currently 11 long-term care or retirement homes in outbreak. 14 outbreaks in long-term care and retirement homes have been declared over. 436 people have now recovered from COVID-19 in our community. Our data is still illustrating that people continue to contract the virus. While we need to plan ahead for the gradual and progressive lifting of restrictions, we need to stay the course for now. I want to take a moment to say a little more about testing in Waterloo Region. As you see through our dashboard, we provide updates on numbers tested based on number of tests done by our healthcare partners who do the testing. Our partners are working hard to do this testing for our community. They put themselves on the front lines, and since swab availability has increased, they have progressively tested more and more people in our community. The efforts of our testing partners over the past few weeks have focused on vulnerable settings, including long-term care homes, retirement homes, and congregate settings. In these settings, we are testing above what is required, precisely because of how easily the virus can spread in these settings. We are currently in planning discussions with our clinical partners who oversee testing to open up testing to the general public who have symptoms as soon as feasible. We all want to see more testing available for more people, and we are working hard to make that happen. Regarding Conestoga Meats, I wanted to provide an update on our public health investigation of cases at Conestoga Meats. Along with the Ministry of Labor, we worked with the plant, including doing an on-site inspection last week to ensure they would be ready to reopen this past Monday after their voluntary one-week closure to enhance their employee protection measures within the plant. This was to ensure all recommended measures to prevent the spread of infection would be implemented. Conestoga Meats has worked diligently to implement all recommended measures and more. This is to address current and future risk. That said, we also investigated what happened in the past to identify what may have happened. As a result of the initial cluster of cases previously reported, public health has been aggressively following up on cases and their close contacts and referring people for testing. As a result, extensive testing was done and continues to be done. As of yesterday afternoon, we informed Conestoga Meats that a total of 44 people who worked at the plant have tested positive for COVID-19. Of the positive cases, 12 have resolved to date. As of May the 1st, only 11 cases had tested positive. The majority of positive results have come back this week. It is likely there was transmission that occurred in the plant before it temporarily closed. We know that these are work environments where the virus can spread easily. That said, it is also likely that not all transmission occurred in the plant. Outside of the plant, there is a considerable amount of social interaction between employees. Many live together and/or carpool together, which can increase the risk in environments outside of Conestoga Meats. At this time, the cases we are now seeing are believed to be from the period prior to the closure and full implementation of PPE, personal protective equipment, and other protective measures. That said, we will continue to monitor testing results as they come in closely and assess the effectiveness of the measures put in place. This is not a foodborne virus, and the pork products coming from Conestoga Meats are safe. The CFIA has a constant presence at the plant to oversee food safety. In closing, I wanted to reiterate the importance of following public health measures such as physical distancing, limiting the number of trips you make outside, frequent hand washing, and not gathering in groups. These measures are what prevents transmission and infection in the first place. Also, receiving a negative test does not mean you no longer need to follow these measures in case you become infected in the future. That's why I ask all residents to act as though you can get COVID-19 anywhere in our community. We have made significant gains, and if we continue to work together, we will hold on to those gains. Moving forward in a thoughtful and measured way is our best course of action. Thank you.
Thank you, Dr. Wang. We'll now hear from Regional Chair Karen Redman. Go ahead, Karen.
Thanks, Julie. Physical distancing and staying at home are important measures to help prevent the spread of COVID-19. But for some, these measures eliminate the ability to escape or de-escalate conflict, even if only temporarily, from a partner or from family violence. The stresses of economic insecurity, together with the anxiety created by COVID-19, can escalate conflict and violence within the home. While community supports continue to operate, we know that the people who need help may not be accessing them. You can help by reaching out to someone who is isolated, sharing information about free mental health support and community services, watching for signals. For example, you can establish nonverbal cues to identify if someone's in need of assistance on video calls. And if you suspect that someone needs help, contact police, Family and Children's Services, or your local shelter. As the province slowly eases restrictions and begins to open access to businesses and retail stores, we cannot relax and assume that it's business as usual. Let's ensure that we don't undo the progress we've made. Now, more than ever, we must continue to practice physical distancing, hand washing, and sanitizing, and if you choose, wearing a mask covering to protect others. Our new reality is that physical distancing measures will continue to be part of everyday aspect of our lives for the foreseeable future. We need to continue our fight against COVID-19, and we need to keep doing what we can to reduce the spread of this virus in Waterloo Region. Mother's Day is this Sunday, and for many of us, it will be difficult to be away from our extended family, especially our mothers. If you don't live in the same household as your mom, it's important that you keep your distance in order to protect her. A card, phone call, virtual greeting, or porch drop-off of food or flowers can still be meaningful and will help keep us all safe. If you visit a cemetery this weekend, remember to use caution and maintain physical distance from others while paying your respects. Thinking about Mother's Day this year, I can't help think about the many stories I've heard in our community about people who have lost loved ones during this COVID-19 period. The added tragedy of possibly not being able to properly say goodbye is heartbreaking to consider. Not to mention the modifications that we have had to make for funeral services in order to accommodate physical distancing. My thoughts are with those people, and especially those who have lost mothers during this pandemic. I cannot imagine how difficult this would be to navigate. This is why we owe it to our neighbors and our community members to keep going. Let's be careful. Don't undo what we've achieved together over these past several weeks. Many have experienced great loss and sacrifice, and we would never want it to be for nothing. As we start to move forward, please remember to take care of yourselves, take care of each other, so we can celebrate our mothers, our families, and our friends soon. Thank you.
Thank you, Karen, and thank you to both of our presenters. We also have Region of Waterloo CAO Mike Murray, who's here to answer questions, and we can actually get to those questions now. So I will start with Damon from Woolwich Observer. Go ahead, Damon.
Hello, my first question's for Dr. Wang. Chartwell Elmira on the dashboard, it says their outbreak was declared on, let me just confirm, on the 27th of April, and then it was declared over on the 6th of May. Why was the period so short?
It depends on when was the last time that somebody was in the home that could have potentially spread the infection to others. It's not always 14 days from when it's declared to when it's declared over. It just depends on the individual start dates of the cases. And sometimes the cases are picked up if they're not showing symptoms. So, or sometimes somebody, for example, a staff person could have picked it up earlier, was diagnosed later because of expanded testing, but that person had no longer been in the workplace for a while. And so that the period that it's really 14 days from the last exposure that could have happened to others. I don't know if that's helpful, but it's not it just depends on the individual circumstances of the outbreak.
Okay, thank you for your clarification. My next question is, with Mother's Day weekend here, the weather's supposed to be extremely cold. Are we expecting community cases to not rise as much as the other holidays we've seen recently?
I don't know if that short period of time is going to have that much of an impact on the cases. I'm just hoping that everyone continues to follow the recommendations that we put out.
Okay, perfect. That's all my questions. Thank you.
Thanks.
Thanks, Damon. We'll move on to Nicole from CTV. Go ahead, Nicole.
Hi, good morning. My first question is, let's talk about Trinity Village, because we've seen an increase in deaths there in the last little bit. What sort of additional measures are being implemented there at that facility?
Well, all the measures that are recommended for outbreak control. And for Trinity Village, we have also implemented supports from the health system response team, and they've been supporting them for a while. Whenever you have a significant outbreak with a number of cases among residents and staff, you can quickly run into staffing situations where you have a number of staff that are off, and then you need those staff to be replaced to care for even more people who are infected. So it's it's quite a strain on homes, and that's why the health response team was brought in to provide assistance to Trinity Village, and we have regular contact with them, and we've also provided support for helping them ensure at their facility that they're implementing the required measures. So we've gone in and done visits and toured the facility, they're implementing the measures that we're recommending, but they have struggled in the past with staffing issues, for sure.
Are you able to say what sort of staffing levels have been topped up and from which facilities?
No, I don't have that level of detail. And it's a constantly evolving thing that's being arranged directly between the home and the health system partners that are redeploying their staff to help Trinity.
Okay.
They're working very hard. The staff that are there. Yeah.
We are now over 100 deaths and getting close to 1,000 cases. Have you done any new modeling to determine how many cases and deaths we'll see in the region by the end of this month?
No, we haven't done any of that yet. We're awaiting some updated provincial modeling. And then once we have that, we'll be able to extrapolate that to our region.
Do you know when that will come from the province?
No.
Okay. And you mentioned Conestoga Meats. Are they planning to open this Monday then, or are you still holding back on opening it because of the cases there?
So they've already opened. So this past Monday, and what we did was the previous week, sorry for any confusion, the previous week, we went in with the Ministry of Labor and inspected and reviewed all the measures that they put in, and we were comfortable with their reopening.
Okay, given the measures, are there things like no more carpooling?
Well, there's certain things that that can be enforced in a plant versus what people do outside of work. But that said, Conestoga is relaying all the recommendations that public health or the Ministry of Labor would have, to their employees. And so, what we do know is that the measures at the plant that have been implemented meet and actually exceed the recommendations that have been provided by the Ministry of Labor and ourselves.
And my last question, you had mentioned that you're preparing for testing for the general public. Can you give us an idea of what that will look like and what it will entail?
I can just say that the partners are in the planning stages now, because we know we're doing a lot of the homes right now, but we're in the planning stages because we want to always, plan ahead. We're in the planning stages to basically open it up to the rest of the population. There are priority groups that have been put out by the province, right? And we've been following those. But that would be the next stage. We open up to anyone in the community who has symptoms and would like to be tested. I don't have specifics at this time, but we're working as hard as we can to expand that when it's feasible. Yeah. Sorry. Is that it? Okay. Okay. Thanks.
Okay, we'll move on to Tim from 570. Go ahead, Tim.
Yeah, for Chair Redman, you spoke about family violence. Have you heard from any of the victims in this time?
Tim, I haven't heard personally. I know that there's been a real push to get the information out there. You'd have to talk to actually the agencies who are delivering those services, but it's been an undertaking by Waterloo Regional Police to outreach and the sexual assault agencies in the community, and FNCS are reaching out as well.
And from a distance, how has the region's resources been handling some of these cases?
Well, my understanding anecdotally is that people have appreciated the fact that there's been full services, albeit some of it virtual, being offered to people in the community who needed it. So I think some people assumed that those services wouldn't be there. The reality is they have been being delivered throughout COVID-19. So I think people are reassured to know that if they need it and they reach out, they will find the support that they need.
Now, you mentioned Mother's Day, and with that coming up this weekend, is there any concern that people will still gather in large groups?
So the guidance from the province remains the same, and until that changes, meetings of over 5 people are banned. I imagine there'll be drive-bys and parking lot or driveway visits to mums, and I think it's really especially important. I know for some people, going to the cemetery is a real ritual. If your mother has passed, it's a day in the calendar they don't want to miss. So we want people to continue to observe physical distancing when they're there. But we're really prevailing. Dr. Wang has talked often about there sort of being 2 trend lines, and we've all worked so very hard to keep community spread at a minimum, and that's a result of following those guidelines. So we're hoping people will continue to do it.
Perfect. Those are all my questions. Thank you so much.
Thank you, Tim. Irene, do you have any questions for us?
Yes, I do. These are for Dr. Wang, and they're about the summary page. I was wondering, of the hospitalized people, there are 41. Do these include patients transferred from a long-term care home?
No, they don't. That's a good question, Irene. They don't, because there's only so far 1 home that has had their residents transferred to the hospitals, and that's Forest Heights. And that indicator is meant to really, you know, follow the trend in terms of people that need hospitalization from the community or from a long-term care home in general, you know, but not taking into account very special circumstances like the transfer of patients during the outbreak, which is very rare.
Okay, great. And another one, this is from the outbreak page. I wondered if any of those cases are resolved that are on the outbreak page.
Oh, that's a good point. So actually, there is a little bit of a delay to our resolved numbers due to the fact that, you know, it's much easier for us to count people that are no longer in an outbreak setting as all resolved at the same time, rather than focusing in on calculating 1 by 1 who has resolved in an outbreak situation, because they're going to still be under precautions during the outbreak, right? So it doesn't really make that much of a difference to them. And so until a home is considered out of outbreak, we generally don't count people who have been resolved as resolved until they're no longer in an outbreak. So there are definitely people in those homes. I see it every day when I get the updates on those homes. They've resolved, they're getting better. It's just that we don't count them right away until the outbreak is over.
Okay, so at Forest Heights, for instance, it says 167 people are in the cases. So
yes, there are a number that have resolved, including staff that have resolved and are returning to work.
Okay.
But I don't have the specifics.
Okay, and using Forest Heights, so does the 167 include the 44 that are deceased?
Yes.
Oh, okay.
That's correct.
Okay. That's it. Thank you very much.
Yes.
Thank you, Irene. We'll move on to Joanna from the Record. Go ahead, Joanna.
Great, thank you. I just have a couple questions for Dr. Wang about testing for the general population.
Sure.
Would that be expanding it to everyone? Would that be, are you going to wait until the province gives a directive, or is that a decision that's being made locally?
Well, the province has let us know that lab capacity has really increased. And so one of the key factors, in addition to swab availability, that was limiting our ability to expand was lab capacity. And so we've heard now from the province very recently that their lab capacity is very open now. And so, we don't really foresee barriers then to continuing to expand testing to more groups. And in this case, it would just be, the next step would simply be to have it available for anyone in the community who would have symptoms. Right now, we're doing a lot of testing in long-term care homes and retirement homes, and in congregate settings that may have cases, we're also doing testing there. And so there's a lot of human resource capacity doing testing right now in places that are considered more vulnerable than the general public. So, you know, we need to sort of make sure that before we open it up to potentially anyone, we also are able to free up some of that capacity as some of that testing goes down. So that will be our main determinants in terms of when we can open it up.
And just to clarify, so when you say freeing up some of that testing capacity, that would be once all the people in the long-term care and congregate settings are tested.
Yeah, no, that's a good question. It's actually not absolute in terms of once they're all done, because we do them in order of priority. So, for example, the homes that were in outbreak, they were done first, right? And but now we're heading into homes that don't have outbreak, that are at in very low risk situations. And so the province has mandated that all long-term care homes, just long-term care homes, be tested before May 15th. So we're going to meet that target of testing all long-term care homes by May 15th. They have not provided actually any direction to ensure that all retirement homes be tested either. But here in Waterloo Region, we have gone beyond the directives and have tested the homes that are experiencing outbreak, because we want to make sure that they're all tested as well. And we do plan to continue to do that testing in other long-term care homes in the coming weeks. However, their risk is very, very low, right? And so we want to balance the testing of those homes at very low risk with, at the same time, ramping up the ability for us to test the rest of the population in the community. What we're seeing from the testing of homes that are not in outbreak is we're not really seeing unexpected cases, right? So, it's not as if, we're going around and testing in homes that have no sign of outbreak and suddenly we have a lot of cases detected by testing. We don't. What we've done and what we've seen so far in the testing is that, in homes that we don't suspect anything to be going on, there's unlikely to be something going on. The tests are coming back negative, or vast majority of them are. So that's why we feel that, we want to do them all and we will continue to work on them, but they're a very low risk situation. And we do know that, we do want to expand testing to the general public as soon as we can. So we're actually working on scaling that up so that we can, balance the two going forward after all the long-term care homes have been done.
And if I could, I just want to add, and I just want to reinforce one of the things that Dr. Wang has said a couple of times, and I just want to make sure everybody gets the nuance. The planning that's going on in terms of expanding testing would be to the general public who are experiencing symptoms.
Yeah.
I think that's really, really important. There is not a plan, Hsiu-Li, correct me if I'm wrong, but there is no planning going on currently to expand testing just broadly to the general public. The next phase will be to the public who are experiencing symptoms. So I just want to reinforce that, because that may have gotten missed, and I don't want the communication to be, oh, it's planned to be opened up broadly. There'll be the next phase, the public who are experiencing symptoms. Is that correct, Hsiu-Li?
That's absolutely correct. And it's actually not recommended
Yeah.
to test people in the community that are asymptomatic.
Right. Yeah. So I just encourage everybody to keep that in mind.
It's only really for the settings like long-term care homes and retirement homes where we have seen a lot of spread, and where testing results are coming back showing that they're sort of early indicators of spread that has already occurred.
And then for you, why do you want to see the testing expand to the general public?
Because testing is one of the tools in the toolbox. And, if there's a capacity to expand it, then it's important to expand it. The province also wants to see more testing, and making sure that we can test as many people as we can over time is going to be important also to continue to have a good handle on on what's actually happening in our community. Like I've mentioned before, when there were some limitations to testing for issues such as supply, we had to go to testing those that most needed the testing because their results could actually change what we do for them. But ideally, if we can test people who have symptoms in the general public, that's where we want to go.
And sorry, I don't recall if this was asked earlier, but is there a timeline on when this might happen?
No, I don't have a timeline yet, but we are working very hard to try to make this available as soon as it's feasible.
All right, that's great. Thanks.
Thanks, Joanna. We will move on to Carmen from CBC. Carmen, how's your audio working? Okay, she was having some issues. So Carmen, if you want to follow up with me, you can do that. Let's move on to Kevin from Global. Go ahead, Kevin.
Just to follow up on that discussion you were just having, if the testing capacity were there, why would you not want to test people that were asymptomatic? Wouldn't you give you a better sense of actually how widespread it is in the community?
Because based on expert advice, it's not recommended. It's not a good test among people that are asymptomatic in general, in the general population. Yeah, that's the current recommendations from the experts at the federal and provincial level. So that's what we're following.
So we've seen 2 days in a row now where the stats have shown more people being cleared of the virus than actually contracting it. Is that anybody should see hope from that?
It's always good to see more and more people recovering. Our stats in particular in our region for the number of cases that have recovered are likely an underestimate because we don't clear them, for example, when they're in outbreaks until the outbreaks are over. So that's one factor. And, we did have a number of outbreaks and we still have some outbreaks. But also, we sort of are relatively conservative here in terms of marking somebody as resolved. So what we found is sometimes it's a little difficult to actually reach people that are well now and to have them call us back and tell us, yes, I'm good now. So until we hear back from them, we don't resolve them, right? And so I know that our stats with respect to cases being resolved are a little bit delayed, but it'll catch up over time. In terms of, number of cases every day getting the virus versus number that are resolved, I wouldn't really see too much into it in terms of the direct relationship between the two, but they're both good signs. The number of cases going down is a good sign. The number of cases getting resolved is a good sign. So they're both charts that are moving, or trends, rather, I should say, that are moving in the right direction. So I'm obviously pleased to see that.
Okay, thank you.
Thanks, Kevin. So Carmen is having some issues with her audio, so she's sent the questions. So I will ask them. First one is for Hsiu-Li. Was wondering what measures are in place at Conestoga Meats to prevent a second outbreak. Hsiu-Li, are you able to?
Yeah, so Conestoga actually did send out their own press release and they put in detail what they have done. So I'd actually, because they know it very well, I'd actually refer Carmen to their press release, which lays it out. But we are very comfortable with the fact that they've reopened. We've done a site visit. We've reviewed their measures. the measures that they put in place have met or exceeded what has been recommended by the Ministry of Labor and ourselves.
Okay, and then the second question I think is more geared towards either Chair Redman or Mike. In terms of unemployment in the region, what is the plan moving forward to connect people with jobs or to reduce the number of unemployed?
I guess I can start. So there, I would say a couple of things. One is, I think it's affected businesses across the region and across the province and across the country. So, I think some of the general measures that provincial and federal governments are taking to support businesses will help businesses locally. Having said that, there's a tremendous collaborative effort underway. The Business and Economic Support Team of Waterloo Region, BEST WR, which is a collaborative effort of Waterloo Economic Development Corporation, Communitech, KW Chamber of Commerce, and Cambridge Chamber of Commerce. They're providing leadership, but it involves dozens and dozens of community partners. So regional economic development people, area municipal economic development people, the BIAs, kind of all working together to say, how can we collectively help with the recovery of our local economy and local businesses? So that, I would say, is probably the biggest effort. BEST WR has a number of working groups that are focused on different sectors of the economy. So for instance, tourism and hospitality, manufacturing, with people who are knowledgeable about and active in each of those sectors, trying to be sort of a focal point and a resource for businesses that need help. So that's probably where we're going to see the most significant amount of effort.
And if I can just add to that, like Mike zeroed in, I think one of the mantras of BEST WR is as they look at moving forward in the sort of the post-COVID pandemic world that we're currently in, is that there's no wrong door. So they really act as a facilitator for the supports that are being offered at both the federal and provincial level, and as well as local, we're giving some relief for penalties and payments. But also United Way was the porthole for the not-for-profit sector. They too have been suffering. I think anybody that usually supports the not-for-profit and the charity sector recognize that so many events and fundraising events have been canceled. So there is money through that application process too, where not-for-profits can find some kind of relief. So it's sort of job related, but it's also social service related.
Okay, so that seems to be all of Carmen's questions. Does anyone else have a question before we wrap things up? Show of hands? No? Oh, Damon, go ahead.
Hi, just a question for Dr. Wang. I was wondering if you're familiar with any so with the test cases per 100,000 for Waterloo region, if you look at like Wellington, Dufferin, Guelph, they go cases per 10,000. This isn't flat out over the province a certain level.
No.
Is there any word on when this will be like a similar, so you can compare by regions, or?
No. And as you probably noticed, different health units release different data. And then, they can release it using different denominators. So no, I'm not aware of a provincial initiative at this time to make these uniform.
Okay, thank you.
Okay, I don't see any other hands up, so we will conclude today's media briefing. Thank you everyone for joining us, and I hope you all have a safe and physically distant weekend. Take care.
Happy Mother's Day.